Hey guys, we are on chapter 8, hair and scalp disorders and diseases. Now, our motivational thought of the day, they may forget your name, but they will never forget how you made them feel. And this motivational quote is because if somebody comes in and they have some kind of scalp disorder or diseases, you're not going to sit there and make faces or say anything to make them feel bad about themselves. So that's what that means. They may forget your name, but they're not going to forget how you made them feel. You did not make them feel uncomfortable about themselves. Okay, so when you first enrolled in cosmetology, what were you most excited to learn about? And I'm sure most of you were excited to learn about those finger waves, right? No, I'm sure it was about color or haircuts or hairstyles, updos, stuff like that. I doubt any of you thought, I can't wait to learn about diseases and disorders, huh? But here we are with another chapter dedicated to diseases and disorders. This one all about hair and scalp. Before you enrolled, had you ever given any thought to hair diseases or disorders at all? Has anyone ever struggled or know someone that has struggled with hair or scalp problem? Me, I knew somebody before I ever went to school that struggled with she had psoriasis on her scalp, and so I know she struggled with that. As a professional, it is your responsibility to understand the various things you will face when dealing with clients. You will have clients who are dealing with postpartum alopecia, candidiasis, trichopitys tullosus, or pityriasis capitis simplex. Don't those sound difficult? I know they're difficult to say, but they're not that difficult. Those are just big words for things we already know about. So, does anyone know what those diseases or disorders are? Yes, you do. You just don't know you do it. They're more common than you may guess, and you will face these on a regular basis. Just in case you were wondering, postpartum alopecia is temporary hair loss after pregnancy. Now, after pregnancy, I don't know about most women. I had twins. So I don't remember losing any hair. I lost a lot of sleep. So if I lost any hair, I'm pretty sure I grew it right back, okay? And most women will. Candidiasis is the technical term for gray hair. Trichoptylosis is the technical term for split ends. And pityriasis capitis simplex is the technical term for dandruff. So now you know what we're talking about, right? So as professionals, it is important that you have a clear understanding of each one of these along with the rest of the diseases and disorders of hair and scalp. And you will learn about that in this chapter. And that is why we need to study hair and scalp disorders and diseases. The understanding these things will help you protect you and your clients from potential hazards and health concerns, which will make you a trusted advisor in the hair journey and solidify the professionalism in the industry. Some of the hair and scalp diseases and disorders can be embarrassing or foreign to people, and they may not know who to talk to about it. There again, you have made them feel comfortable. They will turn to you, the professional. Knowing as much as you can will give them the confidence to steer them in the correct direction for hair and scalp care. To recognize what is treatable by a cosmetologist and what should be referred to as a healthcare provider, you should have a thorough understanding of hair and scalp disorders and hair diseases, because identifying the difference between common and irregular hair loss helps better recommend client hair loss treatment. Recognizing scalp and hair conditions as well as when a client should be turned away and referred to a physician as part of your infection control duties. Now, you cannot sit there and tell somebody, oh, you have a disease and you need treatment for it. We're not physicians, we're cosmetologists, and it's a big difference. And you may say, I think you may need to see a physician for this. You never diagnose anyone. Okay, let's go ahead and start talking about hair loss. As a cosmetologist, you will often be the first resource for a client to help them distinguish between common and irregular hair loss. For example, hair shedding is a natural part of the hair's growth cycle. It's common to lose 50 to 100 hairs per day. but there are some conditions that can cause irregular or even significant hair loss. And I guarantee you, I lose 100, if not more, every day because I sweep it up on my bathroom floor. Okay? So, androgenic alopecia. It's also known as androgenic genetic alopecia. It is hair loss characterized by terminal hair miniaturization and a shortened anagen phase. It can affect anyone and is caused by genetics, age, or hormonal changes. Androgenetic alopecia can begin as early as the teenage years and is frequently seen by age 40. By age 50, almost 50% of men experience some degree of hair loss, and this is by the National Center for Biotechnology Information. Approximately 30 million women experience hair loss commonly after menopause. This is by U.S. National Library of Medicine. Androgenic alopecia is also known as male pattern baldness. Affected men experience thinning and or baldness that generally has a horseshoe shape. Women with androgenic alopecia rarely experience pattern baldness. They typically experience a generalized diffuse thinning over the crown, top of the head, and temporal areas. Alopecia areata is an autoimmune disorder. The immune system attacks the hair follicles, which leads to hair loss in round or irregular shaped patches. White blood cells stop hair growth during the anagen phase, which causes hair to enter the telogen phase. And remember, we talked about this in our last chapter that we went through. 6.8 million people in the United States are affected by alopecia areata during their lifetime. The scalp appears normal in the areas of hair loss. More advanced forms of alopecia areata include alopecia totalis and alopecia universalis. Alopecia totalis, the loss of all terminal scalp hair, and alopecia universalis, the loss of terminal hair on the body and scalp. Alopecia areata occurs in people of all sexes, ages, race, and ethnic backgrounds, and most often begins in childhood. The scalp usually shows no obvious signs of inflammation, skin disorder, or diseases. Postpartum alopecia, the temporary hair loss after pregnancy. Most people experience temporary hair loss 1 to 5 months after delivery. A higher number of hairs enter the telogen stage, which causes hair loss. Typically, the cycle regulates within 6 to 12 months. Hair loss treatment. There are 2 Food and Drug Administration FDA approved products in the United States proven to stimulate hair growth: minoxidil and finasteride. Minoxidil, a topical medication applied to the scalp, it has been proven to stimulate hair growth and comes in 2 different strengths: 2% minoxidil, regular strength solution, and 5% minoxidil, which is extra strength solution. Rogaine is the most well-known minoxidil product, and I'm sure y'all have all heard of Rogaine. But also read the side effects of some of this stuff because in the salon I was working at, we got a sample of it, and my boss lady was like, "You want to take this home?" Because my husband that's when he had started losing his hair. I said, "Sure." Took it home and I started reading the side effects, and I don't know how many, y'all don't really know me that good. But I read the side effects of all medication, whether it's over the counter or prescribed. And depending on what the side effects are, a lot of times I will not take it and I'll let my doctor know. But the Rogaine does say it could cause heart problems. So even though it is topical or, rub on the head or whatever, it does get in your bloodstream. Therefore, it is into the hair follicle, okay? Finasteride, an oral prescription medication. It is more effective and convenient to take than minoxidil, but it may have negative side effects, including birth defects in male fetus, and therefore is not prescribed for people with childbearing potential. These medications slow the rate of hair loss, and some users even experience hair growth. It may take several months of use to see results, and the benefits end when when an individual stops using the products. There are also surgical options available. The hair transplant is the most common permanent hair replacement technique. This process consists of removing hair follicles from one or more areas of the head and transplanting them into the desired area. These transplanted follicles grow typically in the new location. Cosmetologists can help clients with non-medical options such as wigs, toupees, hair weaving, and hair extensions. The emotional impact of hair loss. About 80 million people in the United States experience hereditary hair loss. With multiple studies linking hair loss to lower self-esteem and lower confidence, you need to be aware that this is a sensitive topic that clients may be hesitant to talk about. You are in a unique position to help your clients develop a plan to address their thinning hair. Having a strong understanding of hair loss types, current products, and treatments available and what falls within a cosmetologist's scope of practice in your state will help you serve as resource for clients. Medicine and surgical procedures are the only proven treatments for hair loss. Your role is to help clients determine if hair loss is typical or potentially concerning and advise them on when to seek the help of a healthcare provider. Now, as you know, a lot of men these days are shaving their head anyway, so I don't feel like the emotional impact is as bad on men as it would be on women, but it can be because I know my husband's cousin, when he started losing his, he had picked on my husband for so many years, but then when it started happening to him, he was like, I don't want to hear it. But so it does affect men too when they don't want to shave their head. Okay, hair disorders. Cosmetologists may encounter clients with the following disorders. Canides. Remember, this is the technical term for gray or white hair, which a lot of people are trying their best to get this now, this color. And some of us already have it and we're trying to hide it. Canides result from the loss of the hair's natural pigment. Other than the absence of pigment, gray hair is the same as pigmented hair. The two types of canides are congenital canides is present at birth. An example of congenital canides is albinoism. People with this condition are referred to as an albino and are born without pigment in the skin, hair, and eyes. I don't know if you've ever seen an albino, but they are just solid white. They have no color in their hair. There's a girl that goes to church with us, known her since she was a little girl. She is African American, but she is white. She has no color in her whatsoever. Acquired candidase is a result of age and genetics. As we age, the hair follicle produces less melanin, which causes gray or white hair. Extreme stress or illness can also contribute to the graying of the hair. Hair disorders. Ringed hair, hirsutis, or hypertrichosis. Ringed hair is a variety of canides characterized by alternating bands of gray and pigmented hair throughout the length of the hair strand. Hirsutis is the growth of terminal hair on a woman's body in areas that typically does not have terminal hair, such as the upper lip, mustache area, chin and cheeks, beard area, and chest. Hypertrichosis is a condition in which hair grows longer or thicker than usual. Treatments of hypertrichosis include electrolysis, photoepilation, laser hair removal, shaving, tweezing, depilatories, epilators, threading, waxing, and sugaring. All right, so here's our hair disorders. The first one is the trichoptilosis, which remember is a technical term for split ends. Hair conditioning treatments soften dry ends, but there is no way to repair them. I'm sure a lot of commercials, you've seen them say, this shampoo, this conditioner fixes your split ends. You'll never have to cut it again. No, it does not. It may make it look smooth for a little while, but it does not fix it. The only way to remove split ends is by cutting them. Split ends that are not removed will continue to split all the way up the hair strand. Trichorosis nodosa is the technical term for knotted hair. It is characterized by brittleness and the formation of nodular swelling along the hair shaft. When in this state, hair breaks easily and the broken fibers spread out like a brush along the hair shaft. Trichorosis, these words are hard to pronounce even for me. Trichorosis nodosa near the scalp is often caused by chemical straighteners or excessive thermal pressing. Damage located towards the hair strands ends is caused by mechanical damage such as excessive back combing or brushing and hair aging. Treatment includes softening the hair with conditioners and moisturizers. All right, scalp disorders. Skin is in constant state of renewal. The outer layer covering of the body is shed continuously and replaced by new cells. The skin cells of a healthy scalp fall off naturally as small dry flakes without being noticed. Dandruff can easily be mistaken for dry scalp because the symptoms of both conditions are a flaky, itchy scalp. But there are differences. Dandruff commonly produces an oily scalp. The flakes from a dry scalp are much smaller and less noticeable than the larger flakes seen with dandruff. Dry scalp can result from contact dermatitis, sunburn, or advanced age, and is usually worse by a cold, dry climate. Dandruff, which is pityriasis, that's the technical term, is characterized by the excessive production of shedding of cells. And dandruff is caused by a naturally occurring fungus called Malaysia. Malaysia feeds on the scalp's oil. When the scalp becomes irritated, redness, itching, and dryness can be present. The body responds by producing more epidermal cells to shed the irritant. Dandruff can be affected by stress, pollution, seasonal changes. Anti-dandruff shampoos contain the antifungal agents pyrethrin, zinc, psyllium sulfide, and ketoconazole to control dandruff by suppressing the growth of Malaysia. Anti-dandruff shampoos are available in a variety of formulas for all hair types and can be gentle enough to use every day. Regular use of anti-dandruff shampoo is essential for controlling dandruff. Dandruff is not contagious. All right, the two types of dandruff, pityriasis capitis simplex, is the technical term for the classic dandruff characterized by scalp irritation, large flakes, and an itchy scalp. The scales may attach to the scalp in masses, scatter loosely in the hair, and fall to the shoulders. Regular use of anti-dandruff shampoos, conditioners, and topical lotions is the best treatment for this type of dandruff. Pityriasis statoides is a more severe case of dandruff characterized by accumulation of greasy or waxy scales mixed with sebum that stick to the scalp in crust. Infants with this condition are referred to as having cradle cap. When this condition is accompanied by redness and inflammation, it is called seborrheic dermatitis. Seborrheic dermatitis can also be found in the eyebrows or beard. When trying to determine if the client has dandruff, they should not treat. Look at the color of the skin, flakes in the affected area. Seborrheic dermatitis will resemble a rash. Do not perform services on anyone who has this form of dandruff. Anti-dandruff shampoo can be recommended to a client with mild conditions, but anyone with severe conditions should be referred to a healthcare provider. Okay, fungal infections, tinea. Tinea is a technical term for ringworm. Symptoms include itching, scales, and sometimes painful circular lesions. Several patches may be present at one time. Tinea is caused by a fungal organism, not a parasite. Tinea infections are named for the body part or location they affect. All forms of tinea are contagious and can be easily transmitted from one person to another. Infected skin and hair, as well as unclean bathtubs, swimming pools, and personal articles, are transmission sources. Practicing proper cleaning and disinfection procedures will help prevent the spread of infections. And I saw this a lot when I worked in the elementary school. Kids will grab somebody else's toboggan and put it on their head, playing around and trying to keep it away from them. They'd end up with somebody else's stuff. So it is very contagious. Um, Tinea capitis is a fungal scalp infection known as ringworm. Um, this is used due to the circular shape of the lesion. It has red spots at the opening of the hair follicle. The hair becomes brittle and breaks. There may be black spots in the patches where the hair has broken off. Tinea barbae is caused by dermatophyte fungus. It primarily affects the beard and mustache areas of the face. It is similar to tinea capitis in appearance, and the skin may be very inflamed. Do not perform services on anyone with suspected tinea barbae. Refer this client to a healthcare provider instead. Tinea fovosa is also known as tinea fovus or honeycomb ringworm, and it is characterized by a dry yellow crust on the scalp called scutula. And scutula has a distinctive color, may result from tinea fovosa, and hair will not grow back in the scarred areas. Do not perform services if you suspect a client has a fungal condition. Protect yourself and your client from contagious conditions and refer them to a healthcare provider. Okay? Scabies, pediculosis, capitis, and nits or lice and eggs. Scabies are a highly contagious condition caused by mites called Sarcoptes scabia. They lay eggs inside the skin. Scabies symptoms include intense itching and a rash that may have blisters and bumps that resemble acne. Scabies is spread from skin to skin contact. The mite cannot live no longer than 24 to 48 hours without a host. And do not perform services on anyone with scabies and refer the client to a physician for medical treatment. Pediculosis capitis is an infestation of the hair and scalp with lice. Head lice are parasites that feed on human blood. Head lice are transmitted primarily from head-to-head contact with an infected person. They also may be spread by contact with infested hats, combs, and brushes. Head lice can live only 24 to 48 hours without a host. Distinguish head lice from dandruff flakes by looking closely at the scalp with a magnifying glass. With head lice, you will see small nits or eggs attached to the hair. An adult louse is about the size of a sesame seed. Lice are more difficult to see on an individual with dark hair. They move by crawling and can't jump or fly. Never perform a service on someone with head lice. Over-the-counter treatments are available, and the directions must be followed to effectively kill the lice and the eggs. Now, you don't necessarily have to have a magnifying glass to see the lice, the eggs. They will attach to the hair strand, and unlike dandruff, where you can flick the hair and get it to come off, you cannot do that with head lice. You would actually have to pull take your fingernail and the finger and pull it off, okay? So you can distinguish the ones, and do not work on them because it is very contagious. All right, and I know this is very disgusting, but this is a bacterial infection. Hold on one more moment. Okay, sorry. Bacterial infections of the scalp may be caused by either streptococcus or staphylococcus bacteria. The most common types of staphylococcus infections are furunculus or carbuncles and folliculitis. Folliculitis, sorry. Furuncle is a technical term for a boil. It is an infection of the tissue surrounding a hair follicle. Do not provide services to the boil area until it's completely healed. Carbuncles are boils that form in a cluster. They are caused by staphylococcus and extend into the subcutaneous tissue. Do not provide services until the affected area is completely healed. Folliculitis is an inflammation or infection of the hair follicle. It presents as small red bumps or white-headed pimples around one or more follicles. Mild folliculitis may heal by itself in a few days, but more severe cases need medical attention. Also known as pseudofolliculitis barbae, is a common type of folliculitis. It is an inflammation of the hair follicles caused by ingrown hairs and can occur anywhere in the hair where the hair is shaved or tweezed. Do not perform a hair service on anyone with active folliculitis or folliculitis barbae. Do not perform hair services on anyone with a boil, carbuncle, or folliculitis. Refer the client to a healthcare provider for medical treatment. Properly practicing state board-approved cleaning and disinfection procedures will help prevent the spreading of these infections. Okay, so what we have learned how to explain the importance of understanding hair and scalp disorders and diseases, how to explain the cause of the most common types of hair loss, how to identify the most common hair disorders, and how to identify the most common scalp disorders. Now, please answer your check-in questions in your book, and this is in your red book. I hope you were following along while I was doing the PowerPoint. Put your answers, please number them, and put them in the box below. Thank you.